we are going to see the sympathetic trunk in the neck region. So this is the sympathetic trunk in the neck region, and before going into the proper topic, we have to understand one interesting point, that is the preganglionic fibers for the cervical trunk are derived from T1 to T5 segments of spinal cord. They do not derive from the cervical segments of the spinal cord. And from the thoracic segments, these preganglionic fibers come to the sympathetic trunk and they ascend through the trunk before final relay from the three cervical sympathetic ganglia. That is one over here, and the other one over here, this region. This is a view from the lateral aspect. This is the anterior aspect and this is the posterior region. We can see the cervical nerves in this diagram. Let's identify them. This is first cervical nerve C1, this is C2, this is C3, this is C4, C5, C6, C7, C8, and the first thoracic nerve, that is a T1. Initially, the number of the sympathetic ganglia corresponds with the number of the spinal nerves, but later the upper four cervical ganglia fuse to form the superior cervical ganglion. The fifth and sixth cervical ganglia, they fuse to form the middle cervical ganglion, and the seventh and eighth cervical ganglia, they join to form the inferior cervical ganglion. But sometimes the inferior cervical ganglion joins with the first thoracic ganglion to form the cervicothoracic or stellate ganglion in this region. Each trunk of the cervical part of the sympathetic trunk lies behind the internal carotid artery or behind the carotid sheath and in front of the longus capitis muscle. We are going to see the individual sympathetic ganglia. For doing that, first we are going to focus on this area to identify the structure and branches of the superior cervical ganglion. Later, we will focus on this area to study the middle and stellate ganglion. First one, the superior cervical ganglion. So this is the largest cervical ganglion. This is fusiform in shape and it is formed by the fusion of upper four cervical ganglia. The superior ganglion receives preganglionic fibers mostly from the upper three thoracic segments of the spinal cord. The branches of the superior ganglion, they are divided into lateral around this region, then medial around this region, then anterior will be around this region, and ascending branches we will be seeing in this region. The lateral branches are the gray rami communicants to the upper four cervical nerves. The first one, the second one, the third one, and the last. Laterally, they also give branches to the last four cranial nerves. For example, this is the inferior ganglion of the vagus. You can see the connection between the superior cervical ganglion and inferior ganglion of the vagus over this region. This is the glossopharyngeal nerve. Again, you can see the connection between the ganglion and the glossopharyngeal nerve in this region. That was all about the lateral branches. Now we are going to see the medial branches of the superior cervical ganglion. The first one, before going to that, you have to identify there is something called as pharyngeal plexus. This is the middle constrictor muscle. This is the superior constrictor. So on superficial to the middle constrictor muscle, on the surface of the middle constrictor muscle, you have a plexus of nerves that is known as the pharyngeal plexus. From this diagram, it is very clearly understandable that the pharyngeal plexus is formed by the glossopharyngeal nerve, a branch from the vagus nerve, and a branch from the superior cervical sympathetic ganglion. So the pharyngeal plexus is formed by the contribution from these three nerves. Then what is this structure over here? That is the carotid body at the level of the bifurcation of the common carotid trunk. This carotid body is also supplied by a branch from the superior cervical ganglion. Then we can see a branch is lying very adjacent to the sympathetic trunk. That is the cardiac branch of the superior cervical ganglion. Cardiac branches will be given from each of the three ganglions of the cervical sympathetic chain, and we will be seeing them in the appropriate parts. And regarding the cardiac branch of superior cervical ganglion, on the right side, this cardiac branch will join with the deep cardiac plexus. On the left side, it joins with the superficial cardiac plexus. But the very important point to note is the superior ganglion contains only efferent fibers. It does not convey any pain fibers from the heart. That was all about the medial branches. Now we are going to see the anterior branches. They ramify around the common carotid artery and the external carotid artery. This is the external carotid artery and this was the common carotid artery. They ramify around these arteries and they are connected to the submandibular ganglion, the otic ganglion and the genicular ganglion of the facial nerve through the plexuses around the branches of the external carotid artery. They are the anterior branches of the superior cervical ganglion. Now lastly, we are going to see the ascending branches. This is the superior cervical ganglion and this is the ascending branch of the superior cervical ganglion. In order to identify where they goes, we have to look at a region inside the cranial cavity, and this particular ascending branch is known as the internal carotid nerve, which accompanies the internal carotid artery as a plexus. Here we are. This is the region of the superior cervical ganglion. This is the internal carotid nerve. It enters into the cranial cavity through the carotid canal, and here lies the plexus around the internal carotid artery. From this plexus, you can very well see a branch is arising in this region, that is the deep petrosal nerve, and that joins with the greater petrosal nerve to form the nerve of the pterygoid canal. And the next branches are, the adjacent structure is the trigeminal ganglion, which is lying over here. The internal carotid plexus provide communicating branches to the trigeminal ganglion and to the third, fourth and fifth and sixth cranial nerves in the cavernous sinus. And this is the nasociliary nerve. This is the nasociliary nerve. The branches of the internal carotid plexus which accompany the nasociliary nerve, they are this branch. This is the branch accompanying the nasociliary nerve. They reaches the ciliary ganglion. This is the ciliary ganglion, and this branch will pass through the ganglion without interruption and supply the dilator pupillae and the vessels of the eyeball. Some other branches are also supplied from the internal carotid plexus. They are the carotidotympanic nerves, which are going to form the tympanic plexus in the middle ear. Some other branches are the nervus conari. They are going to supply the pineal body, and this is the internal carotid artery. The terminal branches are going to form the anterior cerebral, middle cerebral and ophthalmic arteries, and the plexus around these terminal branches is going to supply the cerebral pia mater and the tarsal muscles. The filaments around the anterior communicating artery connect to the sympathetic nerves of the right and left sides. That was all about the superior cervical ganglion. Now we are going to see the middle cervical ganglion, that is this ganglion. It is formed by the coalescence of two ganglia corresponding with the C5 and C6 nerves. This ganglion is situated opposite the C6 vertebra, and the common carotid artery lies anterior to the ganglion. The loop of the inferior thyroid artery lies inferior to the ganglion. But sometimes the loop will lie posterior to the ganglion. The middle cervical ganglion is connected with the inferior cervical ganglion by two cords, a posterior cord and an anterior cord. The posterior cord splits here in this region. You can see the splitting over this region to enclose the vertebral artery. You can very well see the splitting in this region. Now the anterior cord, they wind around the subclavian artery, first part of subclavian artery, and that forms the ansa subclavia. Now let's see the branches of the middle cervical ganglion. They are lateral and medial. The lateral branches are going to supply the C5 and C6 spinal nerves. This is the branch to the C5 and this is the branch to the C6 spinal nerve. Then comes the medial branches. The medial branches include branches to the thyroid and the heart. The thyroid branches, they form a plexus around the inferior thyroid artery and reaches the thyroid gland. Now you can see another branch is arising from the middle cervical ganglion medially, that is the cardiac branch of the middle cervical ganglion. They form the deep cardiac plexus similar to the right cardiac branch of the superior cervical ganglion. Lastly, we are going to see the inferior cervical ganglion, that is this region. It is formed by the fusion of the C7 and C8 ganglia. Sometimes the inferior cervical ganglia joins with the first thoracic ganglion to form cervicothoracic ganglion or stellate ganglion. It is located between the transverse process of the C7 vertebra and neck of the first rib. You can see the first rib over here. This is the first rib. In front of the stellate ganglion, you can see the first part of the vertebral artery and the common carotid artery within the carotid sheath, and also the cervical pleura, which is covered by the suprapleural membrane. Behind, you can identify the C8 spinal nerve. Medially, you have the longus colli muscle, and laterally the costocervical trunk, which arises from the subclavian artery. The branches from the stellate ganglion include the gray rami communicants to the C7 nerve and the C8 nerve. The preganglionic fibers for the upper limb, that is, they are derived from T2 to T7 segments of the spinal cord, and they reach the cervicothoracic ganglion by running up the sympathetic trunk. And this is another branch from the inferior cervical ganglion or stellate ganglion, that is the cardiac branch. This cardiac branch is going to form the deep cardiac plexus. The preganglionic fibers for this cardiac branches of the cervical ganglions are derived from the T1 to T5 cord segments. As I told earlier, even though the efferent fibers to the heart pass through the cardiac branches of each of the three cervical sympathetic ganglia, the sensory sympathetic fibers containing pain sensations from the heart, they pass through only middle and inferior cervical ganglia, not to the superior cervical ganglia. Now next is the vascular branches to the subclavian artery, and we can see the vascular branch to the subclavian artery that extends along the axillary artery. Then here lies the vertebral branches, which form a plexus around the vertebral artery. They ascend through the foramen transverse area of the upper six cervical vertebrae and enters the cranial cavity through the foramen magnum. Hope this video was useful for you. Thank you for your patient listening.